This patient we are planning for replacement of molars. The patient lost the molars. They automatically fell down after becoming mobile. There is severe buccal bone defect. So immediate implant and immediate loading we are planning for this. We will see the panoramic view. Now we are seeing the cross section. This is second premolar. This is the first molar. You can see the amount of buccal bone defect. Lingual bone is present. The mental foramen is also near. In the 7 area there is good bone is there, and this is 8. We will see how the post-op goes. So we have placed 3 implants, one BCCX and 2 compressive implants. We will see the BCCX implant. So since it is a smooth surface implant, exposure of the threads outside buccally is not an issue. We could have used a BCS design also, but this is not a place for compressive implant. So in the 7 area we have placed 2 compressive implants, getting lingual cortical engagement. It's a 10 mm implant. This is not lingual cortical engagement, but just touching the lingual border. So totally 3 implants we have used.